Good morning, everyone. I'm happy to see so many of you here early in the morning. I assume you had a great evening, but not too good of an evening. I was asked to come up with a few reflections about the day yesterday, and I was overwhelmed. I had decided to myself that I will have 5 bullets and no more. I ended up with 6, and I wanted to share those with you. The first reflection I had across many of the proceedings were 3 characteristics of the work we're trying to do together. One is the importance of standards. Outcomes measurement is great, but unless you measure the same thing as others for the same patients, you can't learn from others. You don't know if you have good results or not good results, so we need to use standards. The second one is transparency. Unless we're willing to share the numbers with others, we're not going to learn. We're not going to find each other. But transparency should not be on individual providers, doctors, nurses, or others. It should be for institutions. So we build teams that work together to achieve good outcomes. And then the question of equity. Equity in the sense of, if there's big variation, we need to learn from it. We need to try to reduce the equity, but also equity in how we work together, that we respect each other. We work as teams across different disciplines, and we recognize the contribution all can make to drive the change we aspire to. That was the first bullet, and because that was a very long bullet, so he crammed 3 things into 1 bullet. Well, okay. The second one was, I loved Susanna Fox's talk. Rebel health, that's actually what we're in here, what we're trying to do. What we're trying to do together is nothing less than a revolution. And some people get nervous about revolutions, but rebel health, I think, is a great word, because we need to stand up to what we believe is right, and we need to fight for it. And I will carry rebel health with me. I have the book, I loved it. But I think all of you should see yourselves as rebels with the aspiration of making things much better. The third one was the importance of system change. And some of you went to the session where the Dutch colleagues talked about what they are working on, and you heard the representative from the ministry. System change is a journey. It's not going to be finished. It's a continuous improvement. And we need to recognize that we will learn as we go. But system change, making sure that we think of value-based healthcare as a change in systems, I think is key. Fourthly, I love the session and the discussion that Tom Lee led yesterday afternoon. Finances are challenging in healthcare, and they will get no easier. We have people challenges across healthcare. What Tom was saying was we need social capital. And he mentioned 2 characteristics of social capital. One is closure, agreeing on what we are trying to achieve, to use metrics that we agree upon, such as the ICHOM metrics, and brokerage, bring people together to learn from each other. And that ICHOM represents both of those, the standards as well as the community, which you all represent. And the 5th bullet from yesterday was the abstract session. Over 150 abstracts, colleagues around the world who are working on improving healthcare. And what I was struck by was the results they were showing. Past years, we've had lots of great abstracts, but often work in progress. This is what we're trying to do. This is what we're on the road of doing. Yesterday, we had all these examples showing enormous improvements. The outcome improvements shared, sustained over 12 months and more. 90% reduction in readmission rates, not by focusing on readmission rates, but focusing on quality and making sure we do the right thing for patients. I think the impact that we need to share, need to show, and need to bring to the leaders and other decision makers, they're there. And I think next year, I'm sure we'll have even more abstracts and even more examples of how dramatic improvements in healthcare come as a result of value-based healthcare work. The 6th bullet, and my extra bullet, is I just love to see the impact of our president, Jennifer, on the organization. So I'd like you, together with me, to applaud Jennifer. You saw all through yesterday the level of innovation and passion Jennifer brings to all of us, and it's just wonderful to see. Somebody disagreed? And then a few thoughts on what I hope for today. We have, in a few minutes, the launch of the Michael Porter Prize, which I'm deeply honored to be able to stand here and share with you. We have several discussions today about digital and the importance of data. Social capital is going to be important, as Tom said. I believe digital is the second part of this, but doing digital right. We can do digital so that would make healthcare more complex and difficult. We can do digital right so it brings value. And so there will be several sessions on that. And I'm personally particularly excited about the learning collaboratives and what they can do. And there will be discussions about that in the afternoon. There is a discussion on economics, the economics of change, the case for change. Very important session as well, because many of the decision makers will say, all this value-based healthcare stuff sounds good and right, but is it going to cost more? Will we get any return on it? So those discussions are important. I'm absolutely convinced there's no other way to make our system more effective. But the session later today will address that. We'll have several sessions where we'll discuss improvements in developing countries, the principle of leapfrog. Do not replicate the dysfunctional systems we have in the richer countries. Do it better from the start. Leapfrog into value-based healthcare and systems that are patient-centric. And then finally, there will be several sessions that will be discussing how do we improve our approach, the journey to change. How do we learn from how we develop metrics, how we implement metrics, etc. So several sessions will be discussing how we continuously refine our approach to increase the likelihood of success. So those are a few thoughts on yesterday and today, and I'm super excited about the day in front of us, and I hope you are as well. Now with that, I want to move into the next part of the program, which is the Michael Porter Lectureship. There are 2 days in the history of ICHOM that I will never forget. The first time was when the idea of ICHOM was brought up. It was in a meeting in Michael's office at Harvard Business School. And 2 other individuals were there. Tom Lee was there, and Caleb Stowell, who was one of Michael's co-workers. Tom Lee is a friend and advisor since many years. And the idea was discussed, and the slides I used for the discussion was developed by Jennifer Clausen, a close friend of mine. The second day I will never forget was when we, a number of months later, sat in Michael's office. Again, Caleb was there. Martin Ingvar, myself, and Michael were there. And Jens Teisberg, who became the first president of ICHOM. That's when we signed the papers to send to Delaware to register the not-for-profit ICHOM. And some of you, and not so many, I understand, were at the early meetings of ICHOM. And one of the things you will remember was when Mike was on stage and he spoke about ICHOM. He was tremendously passionate about what ICHOM wanted to achieve and what ICHOM would be able to achieve. And Michael had a way of speaking at those lectures with so much passion and energy. And he was so energetic that he would typically break out in a sweat, and it would look as if he had been at a gym, because there was so much energy and power behind his engagement in what we're all trying to do. Michael will not be coming to the ICHOM conferences for health reasons. And so Jennifer, as one of the many innovations she came up with for the ICHOM conference, said, shouldn't we have a prize, a Michael Porter lecture? And so we decided that we wanted to have a prize in the name of Michael. And we put together a committee to discuss what should be the criteria and eventually to choose the first award winner of the Michael Porter Lecture. We had 20 nominees from 9 countries, over half of which were female nominees and half were non-Europeans. But that means about half were European nominees. And the committee consisted of Jennifer and myself, Michael's 2 daughters, Sonia and Lana, Anna Clemens, who has led our conference planning for several years, Sally Lewis, who many of you know as a tremendously passionate and driven proponent of value-based healthcare, and then Jolene Meunier, who is Dutch, has been part of the Linnean Initiative as a patient representative. And when we discussed the criteria, we did that in the spirit of we want somebody who would represent what Mike stood for. We want somebody who has a strategic perspective, combines theory and practice. We wanted somebody who's a dynamic speaker, capable of mobilizing others. We wanted somebody who was pioneering in terms of insights and had published significantly around value-based healthcare. We wanted somebody who had worked widely in the field, not necessarily somebody who had been engaged with ICHOM, but somebody who had worked widely in the field of value-based healthcare. And we wanted somebody who had demonstrated mentorship, to be a teacher, to want to train, share expertise to the broader community. And in the end, the choice was easy. Elizabeth Teisberg was the person, was nominated by several, and it was an easy choice by the committee. Before I ask Elizabeth to come on stage, I wanted to read to you what Michael's daughters wrote and wanted to share with you because they wanted to be here. But Michael's daughters are both young mothers, and in the end, it was impossible for them to travel. They will come, they've said, and join us for consecutive award-winning ceremonies. But I'll read to you what they wrote in praise of Elizabeth and their father's engagement. They wrote this: "While we wish we could be there in person today, we are enthusiastically cheering from afar as the first annual Michael Porter Lectureship is awarded to Elizabeth Teisberg. Elizabeth, this all started with you. 30 years ago, you were the brainchild of and the inspiration for the concept of value-based healthcare. Today, you are a powerful, indefatigable, that's a hard word for a Swede, indefatigable force, relentlessly driving it forward. In our eyes, there is no one more deserving of this honor. We know our dad would wholeheartedly agree. To everyone in attendance today, we want to recognize your tireless work to champion and proliferate value-based healthcare around the world. Together, you are shifting mindsets around healthcare delivery, measurement, and management, an unthinkable feat in such an entrenched industry. If our dad were here with you today, he'd taken this moment to express his profound gratitude to each and every one of you. And then he'd sure say, now let's get back to work, because there's so much more to do. Elizabeth. So, I'm humbled to stand here today on behalf of the ICHOM board, the leadership team, and you, the community, to give Elizabeth this award. The combination of your lived experience, your engineering background, and Michael's strategic view on business and systems enabled you to write what I think will be recognized as one of the 3 most impactful and important books in healthcare 100 years from now. It certainly changed my life. It changed my career, and I will be forever grateful. Thank you, Elizabeth.
Thank you. Oh, you did a picture. Yeah. Thank you. Thank you. He's over there. Thank you. Thank you. It changed my life too. Mike's daughters are awesome. For all of the amazing accomplishments in Mike's life, there is nothing he is more proud of than Lanya and Sonia. They are amazing. Thank you, Stefan. Where'd you go? There you are. Okay, yeah. Thank you, Stefan. You know, your work as co-founder of this organization speaks volumes of your commitment to improving healthcare for all of us. Thank you. I also want to thank Jennifer Bright and the ICHOM team. So let me just ask you, all of you right now, are you feeling a new energy? Yeah, right? I just feel incredible renewed energy here. And I think that has everything to do with Jennifer Bright and her leadership. Jennifer, thank you. So I'm honored to have been awarded the Michael Porter Lectureship. Those of you who know me know I will forever be grateful to Mike. For nearly 4 decades, he's been my mentor, my colleague, and my friend. Delivering this lecture is important to me for many reasons. One of them harkens back to my earliest conversations with Mike about healthcare during and following the medically complicated situations of 2 of my sons. So Mike, who's more into science than mysticism, said he believed that I was destined to do this work. He said he'd only had that sense of someone's calling one other time, and that was with Professor Hiro Takeuchi, whose work is on the Japanese economy. And if you know Hiro, you know that getting put in that company by Mike is really breathtaking. Mike thought that I had a responsibility to work in healthcare. And actually, I felt that responsibility. I spent a year on unpaid leave writing Redefining Healthcare because after my son's tough medical journeys, which I'll mention a little bit about later, I needed to write. I needed to say something, make more sense, make the path ahead easier for other people. But Mike knew that he had a choice and many other important things to do. And I am deeply grateful that he allowed me to pull him in. And, full in. I found the paradoxes and the opportunities compelling, but in the beginning, the uphill struggle of starting a new field, a new perspective on healthcare was daunting. And there was plenty of work in healthcare, but it wasn't about this. Mike's incredible renown and respect and energy undoubtedly accelerated our work's adoption because Mike attracts an amazing array of smart, caring, hard-working people. Take a minute, look to your left, look to your right, look in front of you, look behind you. Mike attracts an amazing array of people. Here you are. I'm also grateful to ICHOM and to this international community for the work each of you do to improve health and care for each and for all. And I'm grateful to people who've worked with me over the past 20 years now to improve meaningful outcomes and achieve better health for the money we spend on healthcare. For a million reasons, I'm particularly grateful to all of you who worked in or with the Value Institute for Health and Care. I know a lot of you are right over there right now. To develop the tools that people need to understand how to implement transformative change. Thank you. So for everyone here, I have 3 requests. For those of you who know Mike Porter, he's not shy about making requests. And since I'm giving the Porter lecture, I'm going to channel him a bit on this and just make the requests straight up. So here's the first one. Commit right here and right now to measuring a few meaningful things for every patient. When you measure a few meaningful outcomes, you and all of us will learn faster about what works and for whom. You need not start with a long list. We talked yesterday about measuring capability, comfort, and calm. The point is to start simply, but even more importantly, simply start. If measuring a few meaningful outcomes sounds like too much added work to you or to your colleagues, then rise up against the endless array of process measures that claim so much of your time and do so little to advance the helping and healing that are the purpose of healthcare. Measurement will direct attention to making change happen. And each of us must make change happen, because as long as we stay with the status quo, we're stuck. You know, COVID gave a shot in the arm not just to people being vaccinated, but to news headlines about health outcomes. During COVID, everyone heard about death rates, about chronic disease outcomes, and the rampant inequity and disparities in health outcomes. The popular press discussions and academic articles on health disparities surged. But I want to be very clear. We need to do more than write articles admiring the problems. We need to do a lot more. We have to change healthcare to achieve better results and eliminate disparities. And that's why value matters. Value-based healthcare is the actionable path to illuminate and eliminate disparities and achieve better outcomes for each and for all. So one of the many things you can do to learn what you need to know to change healthcare many things you can do is to learn what you need to do to change healthcare. I'm proud to be part of the launch of the ICHOM education program, which you heard about yesterday and at breakfast this morning, many of you. And you can learn more about from our team in the exhibit hall during breaks. This program has roots in the courses that Mike and I created at Harvard after Redefining Healthcare published. And ICHOM's program now offers practical frameworks and perspectives designed to empower your work. So marshal your determination, prod your colleagues, push your government, and simply start measuring so you can close the outcomes gaps. My second request is to intentionally build new partnerships that transcend traditional boundaries. I suspect most of you came here to Amsterdam because you know something fundamental. High-value healthcare is inherently relationship-centered. You crave the relationships you find in your community. And you came here to renew those relationships, to recharge your souls. Community helps to enable teams. Because you know that behind every successful transformation is a woman, a team. Sorry. Teams can make relationship-centered care a reality for clinicians and patients and organizations, making information platforms, drugs, devices, policies, and data analyses. These teams need to listen and to communicate thoughtfully and with empathy to ensure that they work together in service of improving health, hope, and healing for those who need care. I'll note that this means listening not only to patients, but to people who need care but don't get it now. So they don't present as patients, but they need to be part of who we're listening to. Susanna Fox described insight from patients as an unexpected source of learning. Jiminy crickets! In our work, learning from patient groups is not only expected, it is explicit in our processes. Patients are experts in their own lived experiences. Our research techniques for learning from groups of patients are part of ICHOM's education program on implementing high-value healthcare. We can do this. We know how. It should not be unexpected. So let's expand ICHOM's community of smart, caring, hardworking professionals and infuse it with the expertise of patients, families, individuals, caregivers. Individual and family expertise enable us to see how to deliver what matters, to see what's missing, and to identify obstacles. The insights from honoring the expertise of patients and families, as well as from people who need care but can't get it now, enables teams to design care solutions that work better in people's real lives, day to day. I'm asking you to commit to including patients and families not only in clinical trials and PROMS or PREMS collection, but also in defining the design criteria for improving care and in setting your research priorities. The patients and families can tell you what those priorities really need to be. Jennifer Bright is clear that ICHOM exists to improve outcomes for patients, and thus patients will be meaningfully centered in ICHOM's efforts, not just as recipients of care, but as experts in the lived experiences of dealing with health challenges and health care. Inclusion and expansion enable the efforts of ICHOM's community to create the momentum of a movement for healthcare transformation. Thank you. We need this momentum to scale high-value care and make it the norm. In some ways, I think the catchy phrase, moving from volume to value, did disservice to our community's work because it sounds backwards. The point is not to downsize healthcare or do less, right? The real goal is to take high-value care to high volume and achieve better health outcomes, capability, comfort, and calm in the lives of more people. High-value care must become the norm. It must serve every patient and family with relationship-centered care and must enable the outcomes that matter most. So let's talk about outcomes that matter most. 2 weeks ago, I experienced one of the wildly joyful outcomes that delights so many mothers. I danced with my son at his wedding. Thomas married the love of his life, a woman who I also absolutely adore. Pure joy. And dancing with my son was even more sweet, given how improbable that event seemed 25 years ago. My son spent 5 years of his early childhood in daily pain. He never slept through the night until he was almost 8 years old because of pain. He was regressing in school, going backwards developmentally, and doctors made dire predictions based on what turned out to be misdiagnoses. And as all of you know, when the diagnosis is wrong, the treatments are all waste or harm. And when the child is in pain, he suffers, and everyone who loves him suffers too. I am so fortunate. I finally got the right diagnosis for my son. The right diagnosis. And it's amazing how quickly the human body heals with the right care. That enabled his full recovery. The right diagnosis enabled his full recovery to robust and ongoing health. After a couple of months on the right inexpensive medication that we imported from France, he never missed another day of school. Full, robust health, ongoing health, and yes, dancing together at his wedding. It was just great. My wish, in fact, the aim of my work is to change healthcare so that we regularly achieve meaningful outcomes for each and for all. The kind of outcomes that leave a mom with the smile that just makes her face hurt. It's where we could be so much more often. Already this community, this ICHOM community, has proven that high-value healthcare is possible. It's happening all over the world. We featured many of the successes in our team's case studies, in the Value Institute's case studies, but let's do more. The ICHOM community can expand these successes and scale them. So here is my third, and most important request today. It's simple, but those of you who know me might find it a little bit out of character, because the simple request is to become outraged when healthcare falls short of what we know is possible in outcomes and in equity. Not frustrated, not disappointed, not sanguine, outraged. When the patient is your son or your daughter, your family member or friend or yourself, you know absolutely that mediocre outcomes are horrific. So let's not sanitize mediocrity. Mediocrity is not okay. It's horrific. In healthcare, outcomes matter. The purpose of healthcare is to actually help people. Of course, everyone should be treated with respect and kindness, of course, right? But healthcare success is not just hard work. And it's not just even good work processes. That's important, but that's not success. Care has to reach the people who need it, and it has to be effective in their lives. So we need to stop explaining away poor outcomes by labeling patients as non-compliant. And if outcomes aren't good, we need to lead change in our processes. If we meaning all of healthcare, if we are going to succeed, we must be determined and resolved to improve meaningful outcomes for each and for all. That determination and resolve is fueled by your outrage, by our outrage. So own it. Be outraged. It's not okay if the outcomes aren't known, if the outcomes aren't consistently good, or if the outcomes are disparate. Be outraged. Thank you.